Hi, welcome to the latest episode of the Modern Patient Experience by Q Squared. I'm your host, James Furbush, and my guest today is the CEO of Thomas Jefferson Health, Dr. Stephen Klasko. Dr. Klasko, thanks for joining us on the show today.
James, it's really a pleasure. It's really an exciting time to be talking about consumer, patient, and user experience in healthcare.
Yeah, I can't wait. So I wanted to start the show. One of the challenges I think with healthcare is that every organization is in some ways very unique, right? And that uniqueness, geographic location, do they have hospitals? Is it urgent care? Almost sort of dictates sort of that strategy and sort of the vision that they're going to have. And so I'd love for you just to start. Can you give us an overview of Thomas Jefferson Health? You've been the CEO for 7, 8 years now, since 2000.
Yeah, it's Thomas Jefferson University and Jefferson Health.
University.
Yeah.
Okay.
So just the 30-second version is I got here 8 years ago. We were three entities. Thomas Jefferson University, was the third oldest medical school in the country. The first one, by the way, that they thought seeing humans was a good idea before you graduated. And it was a 2-hospital system and then an outpatient group. Fast forward, we've done 7 mergers, and we're now an 18-hospital system, 2-campus university. We merged with the number 3 design university, so that we have the first design curriculum in a health entity. We have architecture schools, so the whole issue of safe spaces for health. We have 16 NCAA teams, and we just acquired a $2 billion Medicaid and Medicare Advantage plan. So the quick answer to your question, where Thomas Jefferson University and Jefferson Health, I'm the president of the university and the CEO of the health and insurance system, is we're a $9.2 billion IDFS, in the Integrated Delivery and Financial System, with what will be in November 18 hospitals, 2-campus university with about 8,000 students, and a Medicaid and Medicare Advantage health plan.
So you're juggling a lot, to say the least.
Yes. That's
nice.
fair.
Now that's good context. So I want to start, we're talking about the patient experience, and I'm kind of curious for you as a CEO, what's something about the patient experience that's a commonly held belief that you passionately disagree with?
Well, I think so. Here's what I'd say. I think that this whole issue of that healthcare is too complex is a widely held belief, that we can't do what other sectors do. Like we can't be Amazon. We can't. I think there's a great quote by Sebastian Thrun, who's the Google X guy, who said, "The problem in American healthcare isn't that we aim too high and fail; it's that we aim too low and hit the mark." And I think that's the issue. What we've tried to do, James, is really start to look at that retail experience and say, what I've told folks is, look, I hope that 5 years from now or 10 years from now, if Elon Musk brings folks back from Mars to Philadelphia and they say, "Where's Jefferson?" You can't define that. That somebody would say, Jefferson at my home, or Jefferson at one of 12 micro hospitals, the place where really, really sick people go. I think that's still a 10th and Walnut.
Nice. Yeah, it's not too every day you get someone talking about Elon Musk and related to healthcare, but I do think that's the case. I mean, you see it all the time where, think about any experience you've had in healthcare where there's just like scheduling an appointment and you've got to go back and forth making phone calls. And it's like, I just need a referral. I just need this. I just need that. It can be kind of a frustrating experience. And so sort of based on that belief that you're sort of talking about, that healthcare isn't, the complexity of healthcare is maybe an excuse and a crutch. Can you talk about some of the stuff that you've been doing at Thomas Jefferson, based on that belief? what are some of the initiatives that you've put forward as a result of that?
Yeah. So when I got here, I made a decision that we were going to be a 197-year-old academic medical center thinking like a startup company. So, and I remember making a comment that, I'm an obstetrician, James. And when I think over my career of the amazing advances we've made with individual patients, we sort of have Star Wars technology in our clinical thing with a Fred Flintstone healthcare delivery system. So, what I recognized is, there's several reasons for that. Some of it is your fault. When I
My
say you,
fault.
well, not you specifically, you,
Could be me
but
specifically.
the patients haven't demanded it. So I mean, I think the patients haven't had their "I'm mad as hell and I'm not going to take it anymore" moment. So and that's one problem. The second problem is until recently there hasn't been alternatives, right? So if you think about retail, when it was just Macy's, Sears, Penny's, or or Target and Walmart, you know, or banking, it was, look, I can only get there from 10 to 4. What changed banking? It wasn't the technology. It was when banking started to do banking in supermarkets. I said, aha, I can deposit my check at 10 p.m. I don't have to go to Wells Fargo. So we're starting to see that, I think, in healthcare with the disruptors, the One Medicals, the Oak Streets, the Chen Meds, is saying, look, yeah, why would you put up with that crap? That your traditional healthcare system, makes you put up with. Now, to this point, we've been able to win by saying, oh, you don't want to go there because, we're Jefferson or we're Penn. And, but I think, patients are starting to realize, just as they did with banks, it doesn't matter if your name is Wells Fargo or, it's a supermarket bank. It's still FDIC insured, still got great doctors. Sometimes it's the same doctor. So I think, and basically the insurers have got through the same thing. I mean, think about the 60 bill. But my daughter just had a delivery. And I'm not exaggerating. She got 60 bills, of which 53 of them were from her insurance company saying this is not a bill. So then why the heck did you send it? Right? Can you imagine if that happened in any other sector in your what you do? So what we've been looking at is we want the patients, the consumers at Jefferson, to be able to access healthcare the way they access every other consumer good. And what we've recognized is that we don't have the skill set to do that. They don't teach you that in gynecology school. So we've really partnered with some of the top VCs and founders in the country. So we were one of the primary customers of Livongo.
No.
Livongo became, and good friend Glenn Tolman has a son with diabetes, and he really recognized that diabetic care in this country is ridiculous. Why? Because we think of everybody as a patient. And what I've told my staff is 97% of people, James, in Philadelphia are not patients. They don't wake up in the morning and say, I'm a diabetic patient or I'm a congestive heart failure patient. They wake up in the morning saying, Steve Klasko or James Furbish, and I'd like to be able to thrive today without health getting in the way. So he started this company just based on, I'm going to treat diabetic patients as people. And he said, I'm going to beat you, Steve. I'm going to beat you, traditional healthcare system, because you can only think of them as patients. Come to my office, come to my ER, come to my hospital. So he created an $18.5 billion company just with that realization, right? So I think that we're trying to be. I tell my staff the best way to answer your question is we want to be Target and Walmart, because when Amazon disrupted retail, there were, Sears and Penny said, boy, what a stupid fad. People will always wait in line for 2 hours a day after Thanksgiving. Who's going to shop in their pajamas watching Game of Thrones, online? Well, they were wrong. Target and Walmart said, we're really good at what we do, and our stores really matter. But we also have to get into this game and be just as good as Amazon on the e-stuff. That's what I tell people about Jefferson. Somebody, God forbid, has pancreatic cancer or prostate cancer. They don't care what our digital strategy is. They want to go to the best pancreatic cancer surgeon in our hospital. But for the other 97% of people, I want them to view Jefferson as their health partner. So, because I believe that when they get sick, then they'll just come to us. They're not going to go up and down the Schuylkill Expressway and say, who's got the coolest billboard? So for us, probably the number one thing that we've been getting involved in, which is very unusual in healthcare, very usual in anybody else you'd interview, is consumer segmentation.
Yeah. So say more about that.
So, it always makes me laugh when I see a billboard, Pleasantville General Hospital, we are patient-centered. Like, what the hell does that mean? First of all, are you patient-centered for somebody like me, a 67-year-old with 2 Apple Watches and an Oura Ring? Are you patient-centered for a 35-year-old, disengaged person that, doesn't think about their health? Or are you patient-centered for a 75-year-old with ovarian cancer that, only gets online to see their unbelievably cute grandkids? Which one are you patient-centered? Well, Amazon, as you know, has about 1,987,000 types of us. So at Jefferson, we tried to consumer segment, sort of in our infancy, starting to think about like 6 types of patients. How am I going to get out to a 28-year-old obstetric patient where everything she does is online, versus how am I going to be the best place for, a geriatric patient that, wants to either stay healthy or has a chronic disease. Very, very different ways of marketing. So we don't do any billboard marketing. We don't do the 30-second commercials on Morning Joe of somebody having cancer, walking into our cancer center and walking out smiling. We don't do any of them because, frankly, anybody that's smart doesn't recognize that. And then the second piece is, since we take care of so many underserved folks, we need to figure out how to get to them. And some of that is community health partners and, folks that don't have broadband and, how can we get to them? So we really try to think about the end user at the beginning.
Yeah. So, I mean, it's interesting, right? Because there's probably enough data out there that you guys have probably access to from EMRs and all the technology that's been put in place. You now have a health plan. There's data there. But but it sounds broadly like thinking about, it's like, I mean, is it an access play, right? It's almost like how you bring Thomas Jefferson to these different patients and how they need it. I mean, it's a fascinating, I'd love to hear more about that effort because I would imagine it's not easy, right? It's easy for Livongo. It's easy for ChenMed or One Medical when they're a much smaller organization. Right. Probably harder when you're trying to move the Titanic.
No, you're exactly right. Look, we have 35,000 employees. We're going through a second surge of a pandemic. We can survive without doing that. And so exactly to your point, we have faculty and chairs that, look, I invested $35 million in telehealth, James, in 2013. Literally, my faculty thought it was like I was teaching Satanism. Like, are you crazy? We're a hospital system. Like, why would we do that? So I think, some of it is one of the things that happened, James, it starts with a mission, right? We changed our mission. When I got to Philadelphia, every single academic medical center had the same mission. We'll be the premier academic medical center.
Yeah.
And in Philadelphia. And the way that they defined that was U.S. News and World Report and NIH funding. Think about that. None of that has anything to do with the patient.
No.
So the first thing we did is said, our mission became we improve lives. Well, I can't improve lives without thinking about the end user. So then that changed everything. It wasn't about where are we in NIH funding, where we, and then we basically said, our model is going to be healthcare at any address. Now, we're not going to be defined by our hospitals or the place where the sickest people go. We're going to be defined by the care and caring we give. And we started to hire people that really got that. And then that became a differentiator for us. And then, so probably the thing that's happened most recently that will be really exciting to your listeners. So Hemant Taneja, who is the managing principal of General Catalyst, he was, along with Glenn Tolman, the founder of Livongo. He was also the initial investor in Airbnb, Warby Parker, and Stripe. He wrote a book called Unscaled, and it was about those companies. It used to be if you want to build a bigger, better hotel chain than the Marriott, you had to build a lot of hotels or bigger, better, lens shop, the lens crafters, you have to build a lot of stores. His whole thing was you build no stores and you customize and personalize. So through a series of events, we became really good friends. And it was sort of funny because he said, well, in some respects, you're the opposite of my theory. You've gone from 2 hospitals to 18 hospitals. So it's like, dude, that's the opposite of unscaling. But everything you talk about is healthcare at any address, which is what we're talking about. So we got together, we wrote a book together called Unhealthcare, a Manifesto for Health Assurance. And then we started to say, part of that book was, well, what if we took the best of both worlds? What if a Silicon Valley entrepreneur and a CEO of an academic medical center had a baby? What would that baby look like? And we created that baby. That baby's called Tendo. It's a company we started together. It's basically taking our whole digital innovation and consumer experience team together with about 30 people from General Catalyst that came from, the Palo Alto and Boston world. Exactly to your point, it's easy for them to think about this. It's hard for incumbents. But then the head of that, a guy named Dan Goldsmith, sits on my cabinet. And he's leading our digital front door and our access entities, not from the outside, not from a company, but leading it from Jefferson, leading this company. And then what's cool for the company that we're co-invested in, he can then go and say, hey, look what I did for Jefferson. Look what I did for this barge, and turned it into a creative, nimble, flexible place with great access. And it's number one in market share because it's easier to access. And then he can go and sell that, and we're invested in that. So it really is the epitome of our book of the best of both worlds. It's helping us have healthcare at any address. It's helping us have a digital front door. It's helping us consumer segment with all the sort of creativity and flexibility of a Silicon Valley startup, but with the reputation and the doctors of a top flight, top 25 academic medical center.
Yeah, that's crazy. So, I'm curious. So, General Catalyst, do they have a different way of thinking about these issues? Right? Because it's so much right, it's like agile thinking or how they design products and get those products to be sticky with people and get past the gatekeepers. I'm curious, what sort of thinkings did they bring to the table that you guys have learned and applied at your institutions?
Well, yeah. Look, I think that the general, there's a couple of things about what's happening in health VCs today, and that is that, first of all, there's unlimited money. So if you put A and I in the title, you're going to get $100 million. Now that's probably a bubble that won't last forever. I think where I'm very impressed with the General Catalyst team, and it's true of Andreessen Horowitz and Oak and others, but the team that we've had the most experience with General Catalyst is they've recognized the need for incumbent partners. So with us and a few others, we've really created a consortium of the willing. What are the incumbents that want to jump into that? So now we get to share. So HCA just did a deal with General Catalyst with a company called Commure, which we're involved, which was a fire layer on top of Epic or Cerner. So you're not just stuck with the tyranny of the legacy EMRs, just as an example. So I think what Haymont recognized is, while it's great to create things like Livongo and Commure and Oscar and all these things that are going to bring in billions of dollars, you're not going to transform the health system with that fragmented approach. Yeah. So his point is, how can I bring them together in a place like Jefferson that really changes our whole mindset? And that's where I think about the morphing of the founder brain with the academic medical center brain. And then the other thing is we get a chance to co-invest, so it diversifies our portfolio at a time where revenue in the traditional healthcare ecosystems is really being challenged, right? So I think it's an exciting thing, and then it also brings predictive analytics and social determinants and population health from academic exercises to the mainstream of clinical care, payment models, and medical education, because I brought those two worlds together. Yeah. So to me, that's what's exciting. I think at the end of the day, when you look 5 or 10 years from now, when the revolution happens, there will be Sears and Pennies of incumbents that will go away. There will be incumbents like ours that are Targets and Walmarts that have created the best of both worlds. There will be some startups that, were really go-go startups that didn't last, and there'll be some startups, that people say, wow, they really, just like, look, I'm old enough to remember, the whole search piece. Google was not anywhere near in first place. It was like CompuServes and AskGees and all those. Google was smart enough to say, we're not a search engine. We're going to be the first place you go to on your computer. So they were the one, along with Yahoo and, a few others, that really had the lasting piece, right? So to me, that's what we're trying to do. We're trying to create a Pied Piper effect of other VCs. I don't ever want to be at HIMSS, with 870 28-year-olds telling me to buy their app and it'll transform healthcare. To me, that's what I want to get rid of.
Yeah, I mean, if I never had to go back to HIMSS ever again, I'd probably be okay with that.
The key is to create these co-development partnerships with folks that really get that piece of it. What they get out of it is they learn from us of what's our real needs, right? They're not sitting there in Palo Alto developing, with a 28-year-old, amazingly smart software engineer saying, this is what I think Steve needs. They're literally in my shop.
Yeah.
Saying, oh, okay, now I get it. This wouldn't work because patients don't view things that way, or the doctors don't view things that way. So they get a lot of intelligence. It's like, it's like Invasion of the Body Snatchers, where the alien gets into a human body, right? Gets to learn what humans do. That's
so great. I want to jump back real quick. So, investing $35 million in telehealth back in 2013, to your point, is a little bit crazy. Playing the long game, it was probably good that you had that infrastructure and investments already in place in the last 18 months with the pandemic and stuff like that. Where have you? I'm curious. The concept of like a hospital system without hospitals, right? Like Airbnb owns no hotels, Uber owns no cars.
Healthcare at any address. That's the Jefferson model.
And so making that initial investment, where have you guys evolved that sort of telehealth program, access, care at any point? I'd love to kind of just dive into that a little bit more. I mean, what does that program look like for patients?
So for us, we made a decision. Look, here's, I think, often the problem, James, is that we take the easy road. Like, there's so many hospitals that say, isn't it great? We're doing telehealth, and what they did was they bought American Well, or they bought Teladoc. They're not doing telehealth. They're basically having some, doc from Ohio answer their patients' calls at 2:00 in the morning.
Yeah.
So we basically went all in. We were originally with American Well. We were an initial investor. We then moved over to Teladoc. We co-developed with them. So not only did we take advantage of both of those IPOs, but we said, we want you, Teladoc, to be Intel Inside. I don't want to be a Teladoc customer. I want to create Jeff Connect, which is what we are, which I want to be the largest specialty telehealth or virtual care. We got away from telehealth. Just like, we don't get up in the morning, James, and say, I think I'm going to telebank. It's right. It's just that, it's just the bank went from 90% in the bank to 90% home. So that's what we said. We want telehealth to be a nidus to getting care out to the home. By the way, our most successful thing, remember I told you we merged with the number 3 fashion design university, was we created a wearable that became an IPO called EcoFiber. And the concept of patients going, the pandemic of 2030, we'll have people wearing wearables that'll measure their temperature, measure their respiratory rate, send continuous signals. My car, James, gets better care than I do. Because while it's in the garage, it's sending continuous signals. And when I turn on, it says, hey, Steve, while you were sleeping, my right front passenger tire got a little low. Could you fill it? Meanwhile, I'm going to have a physical 2 weeks from now. And they're going to say, on September 8th, your blood pressure is X, your calcium score is Y, and your pulse is Z. Here's what you should do for the next 2 years. That's asinine. So we've been really building up things around that. So for us, telehealth is just one vehicle for healthcare at any address. But where we really had an advantage during the pandemic is that it wasn't like we had to activate it. In fact, what my Jeff Connect team called themselves was the Night's Watch. If you've ever watched Game of Thrones, they were the Night's Watch. They were that invisible wall that basically saved the people, from the White Walkers. If you think about COVID-19 as the White Walker, So all our ER docs were in Jeff Connect. We went from maybe 100,000 patients, Jeff Connect patients, from 2015 to 2020 to literally 100,000 in 3 months. But we had the supply, so it wasn't hard to do. We didn't have to go to Teledoc and say, oh, can you get doctors? We were ready for that. So now the problem is what happens with payment, right? Because when we first did our telehealth thing, we came up with a model where 50% of our non-trauma, non-ambulance emergency patients could be taken care of at home or urgent care. We would have gone bankrupt because insurers would pay us $1,500, if somebody shows up to our ER whether they need to be or not, and only like $90 if they do it at home or urgent care. So we start with our employees, where we're also the payer, our 35,000 employees. So now we've partnered with all these payers where we have taken about 35% of our ER people that would have shown up to the ER, waited 4 hours, etc., and taken care of them in a very consumer-oriented mobile deposit type way with much better care, much lower cost, and a much better system.
Yeah, that's incredible. So, you kind of mentioned, the pandemic and another pandemic in 20 or 30 years. I know I'm sure everyone's probably tired of talking about the pandemic, but I'm sure in the last 18 months, you guys have learned a lot on that patient, stuff related to the patient experience. But, if we're kind of 20, 30 years in the future and there's another pandemic, I mean, what's something that those people in the future will kind of look back at, how we handled things this year, and will they kind of laugh about? I mean, is it the fact that, the care, it's unconnected, it's the sort of data and the vitals and things are just not as readily prevalent? I'm kind of curious.
No, I think it'll be. Look, I think it'll be the same way. I gave you an allusion to banking. Think about a pandemic 30 years ago. We would have been talking about people, not being able to deposit their checks because we didn't want them lining up on Fridays. I mean, that was a reality. I mean, that was a reality. I mean, nothing in the financial world got disrupted, right? You could deposit your check because you have direct deposit. You could, go to ATMs. Okay, the pandemic of 2030 will be that. You will go to sleep with a wearable. You will know if your temperature rose. You'll know if your respiratory rate rose. You'll have literally, your 3D printer and the Internet of Things, or the Internet of You, will print out customized masks for your face, and also, home, whichever COVID-87, pandemic it is. If it's somebody my age is starting to freak out because you remember the pandemic of 2020, I'll have AI bot psychiatrists and holograms that will be able to say, "Hey, Steve, calm down. This is not 2020 anymore. Yeah, your assisted living facility will take really good care of you." And you'll have supply chain will not be literally, let's get all of our masks and everything from one country. It'll be very individualized and customized, like retail is. And we'll have drone delivery of food and stuff, so you won't have to hoard toilet paper, or line up in the grocery store. So it'll be over in at least from that. And I think you'll have, we've already started to see this, but if you think about vaccines going from 8-year to 6-month timing as we start to create, we have a Jefferson Institute of Bioprocessing. We're one of the leaders in that. You'll start to see reactive vaccine bioprocessing in 7 days, or 8 days or 10 days. Now, what I can't guarantee is that you won't change the ridiculously hypocritical and inconsistent politicians.
Sure.
Because that'll still be humans. Unless we start to get to Android governors and ministers of health, that'll probably still be pretty screwed up. But as far as the health piece of it, it'll be a much more seamless experience.
Yeah, nice. There's probably nothing we can do about the politicians. So So, I want to sort of end, you've sort of talked about, a few companies, Silicon Valley and things like that, and Unscaled and a few things, but, I'm curious, is there someone or, company, I know you're kind of a big Apple fan as well, but, where do you kind of look for inspiration as it relates to the patient experience, either inside of healthcare or outside? I'm kind of curious, where do you go to sort of find better thinking on how you can serve your patients better?
Yeah, it's a great question. So what I try to do is I try to literally go to the folks that I think are creating disruptive experiences. Interestingly, big tech is not that. I think, big tech has become almost too big. They got unlimited money. But you look at, look, Google Health has imploded, and their director just left. When Amazon, JP Morgan, and Berkshire got together and formed Haven, literally, I was giving a talk, and everybody said, "Oh my God, Steve, why are you even coming to work? Because they're going to take over healthcare." And I remember saying something like, "Well, it's like the Loch Ness monster. I'd probably be afraid of it if I ever saw it. I don't think I'm going to see it in my lifetime." And that imploded. Apple, even Amazon have not really conquered health. So I think what I try to do is get inspiration from what's happened in other industries. I was very involved with Apple in the pre-iPhone era, which is really where the creativity happened of going from a computer and operating system old math to a new math of a digital revolution. That's what I've tried to take. Is we call it the old math of inpatient revenue, outpatient revenue, in-person tuition, to a new math of healthcare at any address. So I spend a lot of time. I spend like 5 days a month out in Palo Alto and Boston, just talking to a lot of smart people. Been meeting with this group that Andreessen Horowitz is investing in called EQRX, which is disrupting pharma pricing. There's a company called Zipline that's doing drone delivery for food to get rid of food deserts. And it's just fun to talk to them and then see how they view us. And they're excited that somebody wants to talk to them from the incumbents. And then among the incumbents, I like to talk to folks that are disrupting the payer world, like Oscar and those kind of things. And then, frankly, looking at other industries, I've spent some time with the Tesla folks. Not Elon, but that whole. People talk about the electric car and the spaceship and stuff, but the interesting thing for me has been the Tesla experience. Buy the car online, have it delivered to your place. Once a year, it'll tell you when it needs to be serviced. It's got a key lock. You don't have to leave anybody the key. They'll just pick it up, leave you another Tesla, and bring yours back. Like as opposed to having to go to the place, have somebody tell you the parts. It's just easy. So
Even
if they could do that, if they could disrupt that, those are the kind of things I like to learn from.
Yeah, it's almost like with the Tesla too. It's like even like cutting out the dealerships, right? I mean, that's their big thing. Where car sales are not direct to consumer in a lot of ways outside of Tesla. So when you think about stuff like that, I mean, how do you think about that in relation to, your own health system? I mean,
we need to be D2E, we need to be D2C. When you think about what's messed up about healthcare, look, I mean, think about this. Just the fact that, you have large employers with hundreds of health benefit people just to get through the maze of dealing with a payer. I mean, so you have payers whose job is to get 20 cents on the dollar to make sure that the people that pay for the care, get the care, and provide the care can't talk to each other. There was a Harris poll done where 62% of people thought the way we run healthcare is purposely done to confuse people, to make it more difficult, and to make it more expensive. And they're right? Why would you have, imagine if I couldn't buy something on Amazon without going through a middleman, right? That'd be asinine, right? You want to buy that latest book by Michael Connolly? Okay, well, the payer, you'll have to talk to the middleman, and he'll discuss with you. By the way, he's going to get $2 of the book. That's why we charge $20 instead of $18. They got rid of layers. Tesla got rid of layers.
Yeah.
We add layers. So I think what you're starting to see companies like Amazon Care and Transparent, which is a company we're working with out of General Catalyst, going directly to employers and saying, look, guys, Comcast or, whatever, you're not good at this. You got all these employee benefit people just to try to get through the maze. The hell with that. We will get, if a patient needs spinal surgery, we'll get them a second opinion. We'll get them the most efficient place. By them subscribing to that, you'll say there's a zero deductible because we're gonna save you millions and millions and millions of dollars, because about 30% of those patients that are told that they need spinal surgery don't need spinal surgery and get it done a different way. So, I think you're going to start to see that, right? And the best way to look at it, James, is when the Affordable Care Act came out, we said we're going to give more people access, or we're going to turn $1.25 of healthcare down to $1 and make it easier. You would have sold all your middleman stocks like payers and all your supply chain stocks like pharma. Well, that would have been a big mistake, because United Healthcare is the best stock you could have bought since the ACA came out, other than Apple. Now, how can something get cheaper and better if the middleman has increased by 11 times? If drugs have increased by 11 times? So I think you're going to, that's going to be the revolution you're going to start to see.
Yeah, I like it.
We're going to be part of it instead of fighting it. It's probably the best way to look at it.
Cutting out the fat in healthcare. I will say, jumping back to Amazon, I would actually appreciate a man in the middle. It'd probably help prevent me from like the one-click purchases that I make on a whim that I definitely don't need.
Well, that's their consumer segmentation. They've figured out people like you and I, and they probably send us all. Oh, Steve, did you know there's a new Star Trek animated movie out? Really? Yeah. So yeah, and it's just click here. Oh yeah, listen, it's no different than any other addiction, man. It's like Starbucks. Ugh. They get that smell out. So when you're walking by, you say, I could use some coffee.
Ugh, it's terrible. Well, Dr. Klasko, thank you for joining us today. I really appreciate it. This has been really enlightening and insightful for me. So thank you for making the time to chat with us.
James, it's really my pleasure. And I heard your child had her first day in kindergarten, so good luck. I'm hoping by the time that she is a teenager, she's got that, healthcare at any address, one-stop shopping, and she looks back at the way we did healthcare in 2021 as, God, Dad, what a mess that was.
I'll tell you, if it's more affordable to send her to Jeff Connect as opposed to Partners here in the Boston area, I'd gladly do it. So fingers crossed, but appreciate it.
Sounds great. James, really nice talking to you.
All right. Pleasure's all mine. Take care.